Therapy doll. Dr. Elaine Mercer specialized in trauma therapy for children. Her office at the Briarwood Psychiatric Center was warm, inviting, decorated with soft rugs, pastel walls, and shelves of toys designed to coax silence into speech. Her prized tool was a lifelike therapy doll named Miss Willow. Miss Willow had jointed limbs, real human hair stitched into her scalp, and blue glass eyes that always seemed just slightly too focused. Children were invited to project their emotions onto her. "Show Miss Willow what happened," Elaine would say, placing the doll gently into their arms. And it worked. For years, patients who had been locked in mute grief spoke to Miss Willow, screamed at her, hugged her. One even confessed to a murder no one knew had happened, through the doll. But lately, Miss Willow had become unpredictable. It started with the positions. Elaine would leave the doll sitting on a chair, legs dangling. When she returned, Miss Willow would be lying on the floor, face down. Once, her head was turned to face the door. Another time, her arm pointed accusingly at the bookshelf, where Elaine kept her case notes. Elaine blamed forgetfulness, maybe the janitor. Still, she began locking Miss Willow in a cabinet at night. Until the morning she found the cabinet open, the doll on her chair. A week later, a new patient arrived. Sophie, age 8. Abused, withdrawn, nearly catatonic. Elaine introduced Miss Willow carefully. "This is someone you can talk to, someone who listens." Sophie stared at the doll. Then slowly her lips parted. "Her name's not Willow," she whispered. "She told me it's Annabelle." Elaine stiffened. "Who told you that?" Sophie looked confused. "She did, at night." That night, Elaine set up a camera in her office, just in case. The footage was clear. 1 a.m., nothing. 1:47 a.m., the cabinet door trembled, then clicked open. 2 a.m., Miss Willow stepped down from the shelf. Not fell, stepped. The doll moved with a jerky, almost stop-motion gait. She turned her head toward the camera, glass eyes gleaming. Elaine turned off the footage. She didn't sleep. The next day, Sophie came in with scratches on her arm, thin, deep, like tiny fingernails. "She's mad," Sophie said. "You locked her up." Elaine grabbed the doll, shoved it into a trash bag, and dumped it in the incinerator out back. Smoke rose into the sky. Done. Except that night, she woke to the sound of laughter. Childish, cold. At the foot of her bed stood Miss Willow, skin scorched, dress blackened, one glass eye cracked. Elaine couldn't move, couldn't scream. The doll climbed onto her chest. One hand touched her cheek. The voice was whisper-thin, but clear. "You let them hurt me." In the morning, Elaine was found dead. Cardiac arrest. Except her mouth was torn into a grotesque smile, eyes wide open. In her office chair sat Miss Willow, unburnt, untouched, smiling, waiting. Some stories you don't tell, not because they aren't true, but because the moment you speak them aloud, they start looking for you.